All right, so I wanted to remind you of some of these SMART goals that we came up through in this presentation. So again, these are sort of specific, measurable, attainable, relevant, and timely, thereby SMART. And there were 6 of these. And so to remind you, one related to ensuring that we had a continual process for assessing symptoms and risks for COPD. The idea of trying to plant the appropriate diagnostic process early on in the evaluation of a patient. So that was one key goal. The second was really trying to incorporate spirometry into your practice, with the understanding that the technology is much more straightforward. It is a billable event. And so second SMART goal was to try to increase spirometric use in the diagnostic process. The third was incorporating in a regular basis the assessment of exacerbation risk by appropriate simple queries for acute events, bronchitic events, and so on. So again, within the construct of appropriately assessing a patient, one of the SMART goals was to incorporate into your practice a routine measurement of assessing for exacerbations. The fourth was incorporating a systematic process in your practice for ensuring that you've assessed and trained a patient on the use of the complex nature of the inhaled devices that we have at our disposal to use with patients. So both the assessing of patient use, training of their use, and reassessing of their use. I think another important goal that was set for you was to expand your repertoire of our therapeutic options. There are a broad range of inhaled therapies in the bronchodilator classes, single and combinations, steroid-containing regimens, and I think that you were given some pretty good information regarding how you could tailor the broad range of these classes of devices via different inhalers for your individual patients. So I think that's a very important SMART goal for you to incorporate into your practice. And then the last is to understand the importance of physical activity for patients with COPD, and certainly in the setting of symptomatic COPD, considering formal pulmonary rehabilitation. One of the best techniques for improving quality of life, decreasing dyspnea, decreasing acute events. It is a really good therapeutic technique, and I think that was a perfect 6th SMART goal for you to consider incorporating into your practice.